Good afternoon, everyone. Our project group members are Danarae Vasquez, myself, Olivia Mora, Nicole, Cabral, and Rahima, Haji. We chose eliminating medication errors because getting the right medication for the right patient at the right time is key for safe patient practices and for delivering quality patient care. Patient safety is our main priority, and medication administration is one of the main concerns in the healthcare field. For that reason, we believe we can identify and prevent medication errors while implementing ways to improve and increase our patient safety. So what are some effects of medication errors? First, there's patient harm. Millions of patients and family members are affected by medication errors each year. In fact, recent reports show that there are about 200,000 preventable deaths each year. Now, this includes hospital-acquired conditions from medication errors, but of these, the Institute of Medicine states that there are about 98,000 that are directly related to preventable medication errors. This means that almost half of preventable deaths are from medication errors alone. Medication errors have a multitude of economic side effects as well. There are about 10 million days of lost productivity from the workforce. This is a huge loss in employer and taxpayer dollars just on disability claims, resulting in about $1.1 billion lost revenue. QALYs, which are quality adjusted life years, are not yet being measured, but once they are accounted for, they'll add about another $1 trillion for patients that die from medication errors. Sentinel events and near misses occur frequently and cost the U.S. $19.5 billion per year. These medication errors also result in an increased length of stay for patients. These patients otherwise would have been discharged. These unexpected stays are clearly costly to hospitals. Reimbursement goes down for them, and patients waiting to gain access into the hospitals can't due to bed availability constraints. There are many areas of costly waste with medication, such as energy. For every mistake, there is recourse and rework in any manner is costly. Product waste is also a factor. When the wrong medication is given, the correct one must eventually be given too. And medication is not cheap. Time and money on FTE hours is also wasted. It takes manpower and hours to ID a problem and to find viable solutions to work through that. Socioeconomic effects are real too. We've all heard stories related to area facilities. Hospital reputations are important, and word of mouth goes far, especially when prospective clients and donors get wind. And most of all, patients should not be concerned or worried about the care they will receive at their healthcare facilities. There's a growing concern and focus and demand in the community towards the elimination of medication errors and improvement in quality health care.
Hi guys, I am Rahima. I am one of the group. I wanted to represent slides from 6 to 8, 6, 7, and 8. I will be focusing, exploring the root cause of medication errors. In order for us to reduce medication errors, first we must identify where is the error coming from, who's making the errors, what errors are being made, or why and how they occur. Our main goal is to focus and identify where the medication error occurred, whether it is the patient's care provider or the patient's him or herself. Medication errors are not limited really just to RNs or doctors. Anyone involved with the patient care and medication can make an error. For that, medication errors occurs by giving the wrong medication, the wrong dose of the medication, the wrong route, and even the wrong patient. Medication errors has potential cause patient's death or serious harm to the patient. In addition to that, there is potential legal action against involved employee or the medical facility. For that reason, we came up. We are implanting a goal to eliminate medication errors and to report the event that could contribute to medication errors by training staff and patients as well. On slide 7, we are still on the root cause of medication errors. When we explore the root cause of why and how errors occurred, well, we found out that lack of communication have a quite bit in common, although miscommunication being the biggest predictor when the patient is admitted to the hospital or even comes into procedure. Quite often their medication lists are either wrong, incomplete, or missing altogether. Medication errors that occur from orders are mostly due to miscommunication. Information gets miscontrasted with the verbal or and phone orders, and incorrect readback orders result in medication errors as well. Medication can be in the wrong dosage. Concentrating at the wrong dose can be given as well as wrong route because the order was not written clearly. Also, errors can occur when the medication is mislabeled or units dosing is not clearly marked. Improper hands off is the leading cause of ADE, adverse drug events, due to miscommunication. When hands off are not standardized, it leaves large areas for gap, variance, important information gets missed also. All this contributes to medication errors causing harm and potential death to the patient, which increases the healthcare costs and negatively impacts the community and general population outlook on the U.S. healthcare system as a whole. Um, on the hypothesis side, our hypothesis in PDCA, we wanted to reduce medication errors, control and eliminate gap variance, use PDA method to find our solution. So in order to obtain the most accurate information, a blame-free environment must be created. This way, errors are reported. When errors are reported, we will be able to verify important information, continue data collection that will help us show how we are doing. Our ultimate plan is to reduce medication errors and report the data to improve the public perception of today's healthcare and trust that we are simply striving to the greatest. Also, utilizing PDCA Plan, Do, Study, Act method will help us will help our healthcare organization decrease medication errors and reduce waste and cost down, while it increases our patient safety through continued education and site specific continents. um, Thank you guys.
The first step in the PDCA strategy is the planning step. In order for this strategy to work, the culture of the facility must have a willing to learn attitude as well as a blame free attitude for any of these changes to work. Part of the planning step will include utilizing chart audits and seeing what things could have gone better or where there may have been a potential medication error or where an actual medication error may have occurred that needs to be addressed. So this is where we will find exactly what problem needs to be fixed or what situation needs to be changed. Also, utilizing various data from the hospital's records as well as national records could help in decreasing the gap variances. Another large part in reducing medication error is being sure that all employees are well trained and educated on the latest protocols and guidelines. This is also part of the planning strategy, is figuring out what protocols and guidelines should be in place. Different ways of doing this is to use facility resources to support this type of training and education. Reducing medication errors will ultimately improve facility status and reduce unwanted costs. But not only that, it will save our patients' lives and keep our patients healthy and happy. The second step to the PDCA strategy is the do step. This is where staff get together and figure out what needs to be done. So the do action for our PDCA includes obtaining medical reconciliation lists to find out patients' complete medical history, including outside hospitals and facilities, electronic medical records, and computerized physician order entry systems are systems that staff use to enter medication data. We need to be sure that there are no errors or incompleteness in order for a correct and current patient medical history to be evaluated. These do actions are to be done by any and all clinic staff that have this access. This includes admitting staff, schedulers, RNs, physicians, techs, any of the above. This is the step where all the staff get together and decide what steps need to be taken to reduce these medication errors. This is a very, very important step that needs to be done before anything else can be done. So once these corrections are made, we need to be sure that all staff are on the same page and that they are utilizing the EMR and CPOE systems to their advantage. A large part in making this step go smoothly is to make sure that support for these programs are always available when clinical staff need help. One of the big ways that we can help to reduce medication error is by providing clear and concise readbacks, which means that they are easy to hear and easy to understand. Part of this includes standardizing protocols along the whole system so that everyone is doing the same thing every time. A good standard is using the 5 rights before medication is given. These 5 rights are the right patient, the right medication, the right route, the right amount, and at the right time. So making sure that these are all correct before giving medication will greatly help in reducing these errors. Another way to do this is also to make sure that all staff is educated and trained about these new protocols every time it changes or is improved. In order to fix the errors that occurred during handoff, we have to make sure that the staff, A, develop a standard checklist or handoff form that everyone knows and understands. B, a teamwork relationship has to be made between all the staff caring for each patient. So just making sure that all the staff involved in patient care know exactly what their role is and what needs to be done. C, creating a culture that strives for improvement. Without this culture, it's hard to add improvement if people aren't willing to change. And D, employing post-procedure huddles. These huddles will help to solve any issues that these protocols may create or be able to increase what is working. The third step in the PDCA strategy is check. This step makes sure that all the things in the do category have been done and are being utilized properly and efficiently. Part of the checking process includes looking at audit results from the current EMR system and the primary care facility records and making any adjustments necessary. Talking to the staff that is learning to use these new protocols and guidelines is a good measure at how it is working or not working. Always getting feedback and opinions on how improvements or changes can be made and what is working well is always a good idea. So don't forget to always talk to your staff and find out how new protocols and guidelines are working for them or not and make the necessary changes. The last step to the PDCA strategy is the ACT step. This step is probably the most important. In order for the PDCA to work, the last action must be met and followed through. This is ACT. Acting on situations like medication errors means implementing recommendations, policies, and guidelines. This could also mean making improvements or small changes to the things that already work. PDCA is an ongoing improvement, so we are constantly continuing that and assessing what might not be working and making further improvements. Another important piece to this strategy is being sure that the culture in your facility is used to change and always looking for better ways to improve patient care, especially when it comes to administering medication. Once the check step is complete, there is a good idea at what changes are necessary and what changes still need to be approved upon. For the changes that are working, the ACT step is used to implement these changes. The changes could be made using recommendations or creating new policies and guidelines. If there are only improvements that need to be done, incorporate them into the already existing plan of care. Another part of the ACT step is to continually assess and improve previous steps to work for each facility and each department. Be sure to keep the staff happy and excited for changes that will improve patient safety, like reducing medication error.
Okay, in summary, medication errors are a problem. They're costly and they also endanger patients. However, they are preventable. Our PDCA model identifies where improvements can be made and even offers solutions to some of the main causes of medication error. The first solution is to improve communications. Miscommunication is currently one of the biggest contributors to medication error. It is important for staff members and patients to understand each other, especially during admission when a medication reconciliation is required. When a staff member and a patient miscommunicate during a medication reconciliation, then it is possible that it will lead to inaccuracies and a non-complete medication list. An easy solution to this problem is to inform the staff to keep asking confirmation questions to their patients, making sure that the patients understand what's going on and why the list is important, and why it is also important to give as much information as the patient can about their medication. Staff members should also encourage patients to speak up. There are a lot of patients that already know their own medication. So if they see an error in their medication list, then they should speak up. If they know they are not taking a certain medication anymore, then they should be encouraged to inform the staff members. This can lead to a reduction in medication error. The next solution is to utilize the EMR more. The EMR is a very beneficial tool, especially when there is miscommunication between outside facilities and a patient's primary care provider. The EMR can reduce miscommunications like this by sharing information between the facilities. Also, the EMR can help obtain and record a more complete medication list. The next suggestion is to give the staff members the education and training they need for the technical systems in healthcare, including the EMR and CPOE. If a nurse or any other staff member does not know how to correctly work these systems, then they can easily enter in the wrong information and increase the chances of making medication errors. However, if they have the training that they need and they are familiar with the systems, then it is likely that they will make less errors and reduce medication error. The last suggestion in our model is to implement clear policies and guidelines that will increase communication and teamwork. Better communication will lead to better teamwork, and better teamwork will result in less medication errors. As mentioned in one of our previous slides, following standard protocol of the 5 rights of medication can lead to reducing medication errors. These policies don't have to be complicated. They can be something as simple as having a checklist for nurses. It can be something that prompts nurses to double check the medication and its dosage before administering it to their patients. They are meant to be guidelines in encouraging patient safety. Here are our references, and thank you so much for watching our presentation.